You don't have to necessarily wait until you're ready to be a leader. Most people will never feel ready because we're always going to feel like we're going to need to improve. But that's not the case. You don't have to have a formal leadership role to be able to affect those around us. What you can do is just intentionally show up every day, set an example of positivity and respect, be a problem solver, be a good communicator, and you will positively influence people around you. And that is leadership. And that's how positive culture changes are made.
Welcome to Beyond the Blueprint, a podcast designed to empower healthcare professionals to improve care delivery through integrated design and technology innovation. My name is Keith Washington, and joining me is my co-host,
Kris Baird.
Whether you're redesigning a hospital, launching a new digital initiative, or just curious about the future of healthcare, well, you're in the right place. Let's explore together what's possible when we go beyond the blueprint.
So welcome back, everybody. So this episode is part of our Nurse Influencer series. So I'm really glad to welcome back Kris Baird, who I think I introduced on our last episode where we talked about similar topics as one who needs no introduction. Kris is healthcare famous, is what I like to say, as a book author, as a speaker, as an executive, but CEO of Baird Group. So welcome, Kris. Welcome back to the podcast.
Thanks for having me back, Keith.
And also with us today is Michelle Lingner from ECU Health. So you guys, we recently recorded Kris Lingner, and Kris is Michelle's mom, and her family business seems to be nursing. So welcome, Michelle. Would you introduce yourself for our audience?
Thank you. Thanks for having me on. I'm Michelle. Like Keith had said earlier, I live in Eastern North Carolina. I work for ECU Health. I am a nurse by background and did go on to become a nurse practitioner. I work at the ECU Health Medical Center, which is our main campus. It's about a 1,000-bed level 1 trauma center. And there I do orthopedic trauma.
Well, welcome. So this episode, we want to explore how nurses and clinical professionals can lead without having the formal title or the formal role responsibility. So Michelle is somebody I think you guys are going to learn a lot from. So Kris, I'm going to turn it over to you. Would you give us, kind of your thoughts on this topic?
Yeah, thanks, Keith. I find in teaching leadership and from coaching people on the front lines that you don't need a title to be a leader. You have to be able to influence others. To be a leader, it simply breaks down to, do you have followers, right? And to have followers, you have to be influential in some ways. And it doesn't have to be grandiose influence. It can be the subtle things, role modeling in your department, things like that. And I find that when we're trying to bring a culture up to be more optimal, to be a place where patients want to come for care, where employees want to work, and where physicians want to practice, understanding that every one of us can be an influencer is really, really important. So, Michelle, in your experience, who are the kind of people you would choose to follow in your career?
Yes. So, I really try and follow the people who show up every day and show positivity, show respect. I really like to see the people who are finding these problems to solutions, people who aren't necessarily just seeing gaps in care and just saying, well, that's how the system is. I really like to see ingenuity in healthcare and seeing how we can bridge those gaps and really help to close loops of communication.
Yeah, all that makes perfect sense. And part of what I've experienced as I've grown in my career is to be an influencer. I feel like we have to sometimes manage ourselves first, right? And that self-management can be tricky at times. I don't know about you, but
Yeah.
Tell me about a time where you had to kind of manage your own mindset when you were trying to be more positive and trying to be a positive influence on your peers.
Yeah, so that it's really hard. So I would say when I first started in my career, I was a young gun, and it was very easy to just keep going through a lot of those tough shifts. I could bounce back very easily, but as time started to wear on, those shifts, they sometimes get harder and harder to do. And so things like burnout start to set in. And I would start to feel very negative going into shifts. And I felt like that took a lot more energy just to be angry about nothing, to worry, to be anxious about things that might not even happen. And so, really, it wasn't until recently in my career, I would say probably within this past year or so, where I really started to look at it and I'm like, why am I spending so much energy on this? And so I'm really starting to make intentional changes. So every time before I go into work, I really try and say, I am here to be part of the solution. I don't want to be a part of the noise. And changing my mindset doesn't necessarily change my day, but over time, it started to shift how other people and my colleagues started to approach theirs. Now I find that if I can spread positivity, other people can feed off of it. And maybe sometimes when I'm down, they can help to energize me too. And the really cool thing about this, and when I've really started to see a big difference, is when I see people now in the hallways or I'm just talking to them, they come up to me and they already have a smile on their face. Like we haven't even started our conversation yet, but I've noticed that change in myself. I've noticed that other people are starting to notice it, and it's energizing them. And that's been just like kind of a really cool change that I've recently seen.
That is fabulous. I love to hear that because really it comes down to, I mean, it starts with self-awareness, right? You became aware of yourself, and it really takes some of that self-awareness to develop those constructive thought patterns. And when you develop the constructive thought patterns, you kind of made it into a routine, right? That you were going to frame up this mindset. You were going to approach your day this way, right?
Yeah.
I
Yeah.
love that. I love that.
Yeah. And I think that's
No, go ahead.
I was just going to say that. So that's part of any routine that you do, whether you're going to try and start reading more or you're going to try and work out or be healthier. It is about routine and consistency. It's not just going to happen in one shift. You have to practice it. Really. And sometimes when you are under stressful situations, you can't just like turn a light bulb on and say, oh, well, now I'm going to be positive. No, it takes time and learned behaviors to be able to get good at it, essentially.
And especially in the area where you're working. I mean, you're working in trauma. What's stressful about that?
Nothing.
Of course. Of course.
I mean, you just have to hold pressure on something that's bleeding and, keep the top number over the bottom number and you're good.
Keep the bones inside the body and, but
That's my motto.
that those constructive thought patterns, and one of the things that you said really triggered something with me is I remember coaching a physician who was very stressed out and he too worked in trauma. And I remember talking to him about, you have to anticipate, right? You have to anticipate what's coming through the door. You have to anticipate what's coming next. And at the same time, you can't stress over it. Right? If you can stick to like cognitively anticipating, but being fully present, like you had talked about worrying about what's coming up and fretting about the past, all of those negative emotions keep you from being fully present, right?
Yeah, absolutely.
Yeah. So you talked about being optimistic. You got a lot happening every single day. How do you keep that up when things are stressing you from every angle?
Yeah. So, like I was saying before, it's really just kind of, for me, it's come down to positivity. Like we were saying with that coaching, that guy, it's just a simple smile, a simple joke, just trying to take a step back. And even if you're just joking with everyone about how you're all overwhelmed together, that can kind of bring in a sense of camaraderie. And I'm not talking about this relentless sometimes overly annoying forced positivity, because sometimes that has the opposite effect. But essentially just kind of taking your licks in stride. We're all human. We can only do so much, and you have to know that. But you have to respond to these situations with positive attitudes. And that really will show your true character. If you take it in stride, people, they do notice and they respect and admire how you conduct yourself. Other people will emulate that. They really do. And I feel like that can spark a change, just one person. And you'll see how other people will kind of start to follow that model.
Yeah. I mean, when you were talking earlier about how when you started it, you started to notice how people around you were reacting as they approached you in the hallway and things. Have you actually witnessed you know, a negative culture kind of turning around?
Yes. Around me, yes. I still see it at a distance with other people, with other colleagues who maybe don't approach things with as much of a positive attitude. Maybe if like conversations on speakerphone, I'm like, wow, that really almost just kind of escalated because they were angry, then they were angry, and it just got worse and worse. But I feel like I'm having fewer of those conversations, that a lot of my stuff gets resolved very easily, that we have a good conversation, that things, come together very nicely. And so I'm seeing my internal conversations, my bubble around me, things are going a lot smoother and people are just more enjoyable. I'm enjoying my shifts much more too.
Yeah, that's fabulous. And Lord knows, the work of healthcare is difficult enough. And when you can step back and think about the things that you really enjoy about the work and make it more enjoyable for others, I mean, it can really help shift the entire culture around you.
Yeah.
And I think that what I've witnessed in shifting culture is the first piece of it is just being aware of when things are getting a little toxic or negative or escalating, and thinking about, I wonder what the trigger was, and staying
Yeah.
curious enough to debrief afterwards and thinking about, why did that escalate? And even talking to the people that are involved and
Yeah.
sharing what you observed, like in that phone call you were talking about. If
Yeah.
the person would be receptive to that, talking about what you observed. Because that's the thing about it, is you have to have that self-awareness, but not every person operates at that level. And we all need feedback, I think. We all can benefit from feedback. And one of the things that I feel is essential in a healthy culture is developing that culture of feedback, being comfortable when somebody is really off brand, if you will, or off the values of the organization in an encounter. It was just a misstep on their part, but to have the opportunity to talk to them, that's being an influencer,
Yeah.
on another level. What do you think about that, Michelle?
Yeah, I definitely think so. I've been very fortunate that a lot of the teams that I've been on since I've been in healthcare, we have gotten along very well. There are very few people that have been a stick in the mud on my teams. And so we generally like to be together. And I mean, like you said before, healthcare is stressful. And there are moments where someone's just like, don't talk to me. I don't want any interaction, or maybe they're just a little chippy towards you, and you can kind of just roll with it. They'll be fine. We'll just give them a few minutes. Maybe their dog pooped on the carpet before they came into work and they're just, they didn't even start their day off right. So you just have to give people the benefit of the doubt. Having people that are not within the same culture on the team, that can be tough. Like I said before, I haven't had to deal with that all that much. And I was going to ask you, since you have so much experience in this arena, what do you do when you have somebody who's kind of habitually not being a part of the team, dragging people down? What are some of the techniques that you use to try and retain those people on team? Because obviously we don't want to break teams up. You want to keep them together. What are some of the techniques that you will use to try and help that person?
When you're peer to peer, I would say one of the things, and this is kind of tongue in cheek, But when they're being snarky, I just say, gee, Michelle, I'm sorry you're having such a bad day. Because oftentimes that will make them stop and think, how did she know I was having a bad day? Maybe I need to do an attitude check. But one thing I would disagree on is not everybody should stay.
Yeah.
When you're developing a culture that's high functioning, that really is committed to living out the values and the brand promise, not everybody's going to belong there. And if they're habitually grouchy, having a bad attitude, maybe not pitching in, to me, that can be dead weight. And as a leader, I mean, those are the people that I believe everybody deserves to be coached up, right? When you spot those behaviors, to take the time to let them know what you're seeing, because chances are they've never been called out on it. I've worked in organizations where somebody has been 30 years with an organization and they're snarky, they're rude, the doctors don't like working with them, the peers don't like working with them, the patients complain about them. And I look and I think, this isn't rocket science, folks. This person doesn't belong here. And so there are times where to be an influencer, you may have to make your feelings known to people who have decision-making power, because that dead weight can spread like a cancer. And the challenge can be that they are influencers. They are influencing, but in a negative way, right?
Yeah.
And they're influencing the high performers to check out. Right? Because every 2 weeks, they're collecting a paycheck, whether or not they're snarky, whether or not they are rude to patients. And so, I would just say in that situation, remember they too are influencers, but what direction are they influencing? And it may not be a good fit for the organization that you're trying to create.
Absolutely.
And you may even get them carpet cleaning services for what happened with the dog, Michelle. That's the other way.
Employee benefits.
The only reason why I said it is because it happened to me the other day. I was like, I'm going to be late now.
I had a feeling. I was going to ask you. It's like, did that happen to you? Because, is that...
Yeah. It kind of rolled off your tongue, top of the mind awareness, right?
Did you happen to snap at somebody? Did you happen to snap at somebody at work that day? How did you handle it? Did you keep your cool?
No, I don't even remember.
No.
I think it was so, I've got a friend that will help to take out my dog. And I was just like, I'm really sorry, but if you feel like dealing with this, can you just clean it real quick for me?
Nice.
I think it's fine. Stain is gone. We're good.
So I think one other thing is, and this goes back to what we were just talking about, is that I think to be an influencer too, I think it's important to avoid complacency. And I'd love to know your thoughts on that, Michelle.
Yeah. So I think a lot of it, and things that I see just from more of a clinician standpoint, one of the big problems that we have is just complacency with communication. So, and this really just honestly, yesterday, I had a shift, and this is a prime example. So like a lot of my consults that I do, they are all over the hospital. It's not just in the ER. I'm on every floor known to man, and I don't know everybody in this hospital. It's massive. It's 1,000 beds. So I don't have everyone's cell phone and just be like, oh yeah, this is our plan. This is what I'm going to do. But what I do is I at least try and have some sort of handoff, whether I'm flagging down the nurse or I'm secure chatting the resident. I feel like it's a small extra step, but it makes the biggest difference in the world. And people, they're so appreciative when you can kind of circle back with them and just say, hey, this is the plan. Because a lot of these people, they don't necessarily want to bug you. Everyone's busy, but they also can't sit at their desk and refresh, just waiting for my note and my plan to come through. And so I've really found that just a simple little handoff, like I know exactly who's on call for this person or who's taking care of them. I can see it in my EMR. Just shoot them a little message and say, hey, this is the plan. Just wanted to let you know. And people, they love it. And I feel like that is part of finding that gap, finding that patient care sometimes is delayed by not being able to relay a message fast enough. And you're finding that gap and it's not even a huge solution. I'm just taking a little extra time out of my day. There's zero ingenuity in that, but it's being able to not have that complacency of they'll just find it later. No, it's taking the problem, finding an easy solution and being able to execute it. And there you go. Bob's your uncle. You've just solved a problem that everyone's trying to work on. And it's just about taking a little bit more time and not being lazy, honestly, sometimes.
Well, it sounds to me like that's taking ownership, right?
Yeah.
And I mean, you're thinking of the good of the patient here. You're taking ownership. You're going that extra step. You said it doesn't take a lot of ingenuity. It takes grit, though, to be able to consistently do that. I mean, kudos to you because, that's a tough job. And to take those few minutes to do that handoff, to secure that communication for the good of the patient. The other thing you're doing there beautifully is you're building relationships, right?
Absolutely.
And to be an influencer, you got to have some relationships, And so it's like every time you do one of those things, you're building your influencer bank account, right? And you're collecting those chips, if you will. And
Yeah.
you never know when you're going to need that.
Yeah.
Other tables are turned and people
Yeah.
will remember you.
I find that I think on the externally, I appear much more approachable because I'll have residents come back to me like, you're the ortho girl that I talked to last week. Thank you so much. And, they're not as shy to message me about something else because they know that you're not going to bite their head off, because in organizations like this, things are tense. People are bombarded all the time. And you've all heard the stories about surgeons just chomping heads off, and so people, they just want to try and avoid getting their head chopped off, which I get. So I feel like you just you have a much softer approach to you, and people find that you're much more approachable. The other thing that I was going to circle back to is, delay in care just by communication is something that we can really help the workflow, especially in our hospital. So we're a level 1 trauma center. We are the only trauma center for all of Eastern North Carolina. We don't go on diversion. So it can get overloaded very fast. And one of the big pain points is the ER. I've noticed since COVID, we've had to open up hallway beds. I mean, there's people all over the place, and it's not just us, it's everywhere in the country that I've asked my friends
Yes.
who work all over the place. They're like, yes, the ERs are they're crazy. We can't get people in and out. And if I can give somebody a piece of information up front that can help a discharge go through and get somebody out, we're talking about a bed opening up 1 to 2, 3 hours before it would have if I wouldn't have said anything. And that's just going to help so much workflow to come through and hopefully either get somebody up to the floor or get somebody out, because we really need to start working on moving people through the system a lot faster. And I know that we can't always do that, but if there's 1 or 2 patients here or there that we can help with, it can make a world of difference sometimes.
Absolutely. So there again, gave a great example of opening the door through communication and being an influencer by being a role model. Role modeling those behaviors, role modeling that attitude helps develop smoother processes and systems. And whether you realize it or not, chances are very good people are noticing and they're following along. Even
hope.
just your example of, but even your example of somebody saying, hey, you're the person from ortho that, called yesterday, they're noticing.
Yeah.
And they're appreciating. And, it's like, how does water erode land? 1 drip at a time, right? And sometimes that's the influencer, shifting the landscape 1 drop at a time. And, hopefully as you are doing these things, you are developing followers who say, I want to be just like Michelle. I want to be like that. She makes me feel good when I'm around her.
I hope.
Well, I want to say thank you guys. We're kind of coming up on the end of our time here, but I really appreciate this conversation. I appreciate your commitment to the profession and to leadership and to being an influencer. It's really great to hear from both of you. I guess for our audience, I hope they're encouraged. This takes practice. This takes commitment. That this isn't something that's just going to happen on its own. So wherever this meets you, wherever you are, I just encourage you to maybe take this to heart and think about, what does it mean to me when I show up tomorrow and put on the uniform and show up? Could I just make sure that you've learned something here? That'd be awesome. So I guess with that, do you guys have any closing remarks? Kris, any closing remarks?
Just that, to reiterate something I said earlier, it just takes one action repeated over and over, and it's self-awareness and creating those habits that make you show up as an influencer.
And Michelle, do you have any closing remarks for our audience? We really appreciate you being on.
Yeah, absolutely. Thanks for having me. I've had a great time. I would say that you don't have to necessarily wait until you're ready to be a leader. Most people will never feel ready because we're always going to feel like we're going to need to improve to be able to show, some sort of leadership role. But that's not the case. You don't have to have a formal leadership role to be able to affect those around us. What you can do is just intentionally show up every day, set an example of positivity and respect. Be a problem solver, be a good communicator, and you will positively influence people around you. And that is leadership. And that's how positive culture changes are made. I like to say, when you choose to lead yourself first, it gives others permission to do the same.
Very well said. Well, thank you so much. Thank you for your time, and thank you to our audience. And that's a wrap. Thanks, everyone.
Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.